Good morning. The Senate Finance Committee is in session, in a voting session, and we're dealing with a single very important bill, Senate Bill 172. All right, we'll ask everybody to remember that since the public has a hard time hearing as we do, muffled under these masks, that everybody will speak in your stadium voice.
Senate Bill 172 establishes a process for designating health equity resource communities to target state resources to specific areas of the state to reduce health disparities, improve health outcomes and access to primary care, promote prevention services, and reduce health care costs and hospital admissions and readmissions. The Finance Committee is second on this bill, while B&T is primary. B&T made a number of changes to the bill. Most notably, the B&T amendments established a preliminary Pathways to Health Equity program to provide a preliminary round of funding to programs with an eye toward those programs transitioning to self-sustaining programs under the fully realized HERC program. Funding for the Pathways program is provided using funds from the Relief Act. Senator Hayes is offering a series of changes to the bill as it was passed by B&T that primarily deal with three things. First, the Senator Hayes amendments return control of the fully realized HERC program to the Department of Health, where B&T had situated the program under the Community Health Resources Commission, which will operate the initial Pathways program. Second, Senator Hayes has changed.
Could I ask a question?
Yes, ma'am.
Is B&T aware of the amendments that we're considering this morning?
Yes.
Are they okay with them?
Counsel for B&T was on a call where these changes were discussed yesterday. The bill will, if passed by the Finance Committee, need to go back to B&T. I have not spoken to the chair in B&T to understand where he sits. Back to the changes that Senator Hayes is offering. I'm just going over these in broad categories before we actually move through the reprint. Second, the Hayes amendments, as requested by B&T, alters the composition of the HERC Advisory Committee. And finally, the additional changes authorize HBCUs to serve as a specified evaluator. Other adjustments are made to the timing of certain reports and deadlines for issuing certain requests for proposal, all in an effort to sort of harmonize the bill. So looking at page 1 of the reprint, you can first see this instance in line 7 where secretary is being reinserted into the bill. Because we're not dealing with completed and finalized B&T amendments, it's not marked the way you would. The only distinction between the B&T changes and the one Senator Hayes is offering is, as I've underlined or circled or put an asterisk next to. Moving on to page 3 of 23 of the reprint, this is the new Pathways program that was established by B&T. The purpose is to provide the foundation and guidance for a permanent HERC program that comes later in the bill. Over on the next unnumbered page at Roman numeral 2, in the middle of the page, it says that on or before February 1st, 2023, the Commission is required to issue a final report to the Governor in accordance with specific provisions of the state government article that cover what they learned through the issuance of grants previously. At the bottom of the page is the first mention of the Pathways to Health Equity Fund in the Commission. That fund consists of $14 million authorized for the Commission under Chapter 39, so that was the Relief Act. Moving ahead, the B&T amendments include this change to the insurance article that authorizes the movement of funds from the Health Benefit Exchange Fund to support the fully realized HERC program. Those transfers occur in fiscal 2023 through 2025 in an amount of $15 million. Moving along, this is the establishment of the Health Equity Resources Communities subtitle. Throughout this subtitle, instances where the secretary is referenced are returned to their original form, where Budget and Tax had substituted the commission. At the bottom of page 6 of 23 is the new advisory committee. Again, when B&T passed the bill and sent it over to the Finance Committee, they specifically said that they were leaving to Finance the precise composition of the advisory committee. Here, the chair of the Community Health Resources Commission, which had been running the Pathways program, is a named member of the advisory committee, as well as 3 members appointed by the governor, 3 by the president of the Senate, and 3 by the Speaker of the House. Only 2 of those 3 members for each appointing person are specified. There's some flexibility there. Moving along to page 9, Senator Hayes asked that so B&T passed the bill with the chair of the Community Health Resources Commission serving as the chair of the advisory committee. Senator Hayes asked that it could also be the chair's designee. Down at the bottom of that page, the date of the initial advisory committee meeting is adjusted to be September 1st of this year. Moving along to page 11, at Senator Hayes' request, the Secretary is required to issue a request for proposals for designating the HERCs on or before July 1st, 2023. On the next page, in beginning on page 12, we see the some of the discussions of the specific elements that need to be included in an application for a HERC. One of them, beginning in C, is that the application must include the funding for 1 full-time employee to serve as an evaluator of the operation. Senator Hayes is offering the new subsection D, which specifies, notwithstanding the provision to hire a full-time employee, a historically black college or university in the state may contract with the proposed HERC to provide evaluator services. And that is a summary of the changes that Senator Hayes is offering to the bill. I can answer any questions.
I would just ask one, of the changes that the sponsor is making, is there anything that so changes the major components of the bill as B&T sent it to us that you would be concerned about?
Not that would make me personally concerned, but the most substantial change is positioning the final HERC program under the Office of the Secretary of Health as opposed to within the Community Health Resources Commission. I believe Senator Hayes can speak more specifically to why that change was requested.
Okay. Well, I see a number of lights on. So let's hear from the sponsor, then we're going to go to all of this.
No, thank you, Madam Chair. Couple of things. One, we've been working very closely with B&T, and I think, the chair of that committee has done an extraordinary job at finding an ongoing funding source. As you all remember, when this bill was first introduced, it proposed to increase the alcohol tax by 1 cent on a dollar. Because of the creativity of B&T, they were able to strike that, so that's no longer part of the bill. And B&T has been able to find another funding source to see this go along. So I'm forever grateful for the work that they put into it. I think what's before us now, B&T has already settled on the funding sources and those concerns that may have raised, but before us now there's some of the policy issues. And one, the one that we haven't really landed on a consensus around is really between the health department versus the CHRC, I believe it's called, the commission. As you all know, the CHRC does awesome work at disseminating grant funds, and they do it to a lot of small organizations. That organization, though, the commission has a staff of 4 individuals. So we'd like to proceed with, having them, at least in the first 2 years, be able to get the funds out the door, as we all have already voted for that money to be in a recovery. But going forward, we would love to have the benefit of Department of Health, given all of the data and expertise, and especially on a bureaucratic level that they have. And just to give you an example of some of the contributions of the various agencies that are within them, you have, the population health management. They do maternal and child care, chronic disease prevention, environmental health, healthcare system transformation. The expertise that the Department of Health have to help inform, like really addressing these disparities throughout the state, is valuable to seeing it go forward. And so on a policy, I think that's probably the main sticking point on whether it continues to stay with the CHRC in perpetuity, or if the CHRC starts in the beginning, but then we benefit from the expertise of those professionals that are embedded within Maryland Department of Health. And one of the compromises that we've made is the CHRC will continue even throughout to be the fiscal agent and the administrator of the grants, but we will benefit from the robust expertise that the Department of Health. And so I think that's the only issue at hand here, where there may be, may need to be some consensus brought around. But at the end of the day, I think this committee has been charged with some of those policy decisions, and then it'll still go back to B&T to make the final decision.
Okay, I would just suggest that you might want instead to consider having a decision point that the General Assembly would make at the end of the 2 years to decide, because that the agency where they wanted it, I think, does a good job when you really got ongoing funding and you don't want it to get lost elsewhere.
Absolutely, and I think the decision point was addressed in that after the 2 years, the commission would be charged with giving to the General Assembly a report to outline some of the ideas on how it would go forward. Okay. So that's been addressed in the legislation.
All right. Senator, I'll start with the Vice Chair, then we'll come down this line.
First of all, this is a very important bill. I'm a co-sponsor of the bill. We need to pass something. Just before we just jump over the funding source, I do want to I think it could come up on the floor, is we did pass another bill out of the committee, dealing with state-based subsidies, tapping the same reinsurance money that this bill now under B&T's model. So I know that there's been some chat with Michelle Eberly from the Exchange. Does this funding source for this bill have an impact? I think the answer is probably not, but it would be nice to have from the Exchange something, because there's a lot of money in there. That other bill, allotted up to $20 million for this new pilot project to try to subsidize young, healthy people into the risk pool, if you recall, passed. So I think, not for purposes of moving it out of here, but when we get to the floor, somebody could ask, and I think right now the answer is, well, we don't really have an answer, and that might not be good enough answer. So I just want to put that. Let me just throw out the second issue, and then I'll yield back to the sponsor.
I would just, I think you're asking a good question, but what the Exchange is doing is more about people's ongoing individual health care.
No, but the funding source that now the B&T is using is the same reinsurance money that we tapped for the other bill. And we need that same money for the reinsurance, which is the whole point of the reinsurance. So we just,
But let me just finish my question.
Yeah.
Here, they are trying to also get at environmental and governmental reasons why some of the people need the health care in the first place because of what isn't being done. Okay, think of environmental conditions that are impacting public health. So it's making it more expensive to cover the very people
Right.
that the exchange is
Look,
trying to deal with.
I 100% support the bill. I'm just making an academic point. It's all going, we have several bills going after the same money to fund it. Can I just make one other point on this? I agree with the sponsor, the one sticking point. The only thing I would say, and we know, the gentleman runs the commission. I mean, there is an argument here, and I like what the chair is maybe putting out there, the idea that you start with the commission for a couple of years and then you midstream send it to the Department of Health, who we don't know who future governor, we don't know who the Secretary of Health. That's one thing. The other thing is, from what I understand, is B&T gave that commission new pins to help them work through some of the work that would be in the first couple of years, whereas Department of Health in the original fiscal note, this is what I'm told, they may be able to take it with existing resources, but they asked for 6 more pins to actually do some of the stuff that's embodied or envisioned in the bill. So I think this idea of the commission coming back with the report, but at that point, before we automatically send it to Department of Health, I think then maybe we revisit it. I think that may be able to bridge where B&T was coming down and where the House, I think, is. So I'm not sure I love the idea of automatically be conferring 3 years from now or 2 years from now the Department of Health before we even have a report from the commission. So I think there's some there, but I think it's a great, important bill. But I just want to raise those 2 points, Mr. Sponsor.
Thank you. Senator Augustine, Senator Hershey, and then Senator Jennings.
Thank you, Madam Chair. First of all, I very much support the bill and would ask for an amendment to be made a co-sponsor since my name is not on it.
Me too.
That's for one, for sure. The second thing, though, that as I look at this, though, and I'm looking at the CHRC, I'm looking at the composition of the CHRC, and maybe you can speak to this a little bit. There's not a whole lot of diversity. I mean, when I'm looking at this list and we're asking this group of people to work on this, can you help me to get comfortable with that, sponsor? Or do we, and I don't see any kind of like protections of additional voices in this conversation. Can you help me with that?
So the CHRC, for our staff, there's not a lot of diversity. I think you're dead on with that. However, their governing board has a lot of expertise and a great deal of diversity, and they're the policy kind of oversight of the staff. But the vice chair had raised a couple of issues, and one, and as it relates to the health exchange, as you all recall, the exchange originally came to us and asked for $60 million to be siphoned off in a pilot program that we then approved. They were only allowed to use $20 million of that for the pilot. And so there's already an indication that we all know from the exchange that there's a significant amount of money already there. And I think, and obviously it's above kind of my knowledge base, but obviously B&T with the expertise in funding and finance has a better idea of what actually could be sustained by the reinsurance fund. And so I would imagine that they would take on that responsibility of working it out with the exchange. And you raised another point. Oh, the other thing is the report from this HCRC is due in October of 2023. That's only, 2 months before we come back here as a legislature. And so based on what that report is telling us, we then have an opportunity if, they present the compelling story that maybe it shouldn't just go over to the health department to make those changes 2 months later here in the General Assembly. And so I think we've reached a delicate balance at making sure that that transition takes place and that we have the legislative oversight and responsibility to make whatever changes in amount of time to make sure that the money continues.
My question.
Oh, the diversity part?
Yeah.
About the CHRC.
I mean, the CHRC and or providing some guidance. I mean, you know how in other places people are a part of the process as they're building, they're in that first step, right? The Pathways to Health
Yep.
Equity program.
Absolutely.
usually I would suspect that there would be something in that part. You know, it's new.
Oh, I
Be
see what
something
you're
in
saying.
that part where we would have some engagement with some folks who are maybe a part of that, of the community that we're talking about. You follow me?
Right. And Nate, if you can help me out, I'm gonna breeze through here really quickly. But there is an advisory board in addition to the CHRC's board that will look at some of these things. One of the things that the advisory committee, and if you look at page 4, lines 21 through 22, some of the things, among those things to be considered by the advisory committee would be adversely affects groups of individuals who have systematically experienced greater obstacles to health care based on their race or ethnicity, region, socioeconomic status, gender identity or sexual orientation, age, mental health status, cognitive, sensory, or physical disability, geographic location, or other characteristics historically linked to discrimination or exclusion.
Is that for the full program or is that for the initial program?
This should be for the full program. Nate could correct me on it.
But
as well.
I'm talking about the formation. You know how you got this you got the pre that's going to create it.
Right.
If that were a part of that, then I would feel better. You understand what I'm saying?
Well, let me butt in and say one thing. I'd like to just hear what the other questions are. The vice chair has got to go for that 2-hour training
Oh.
at 10 o'clock. And we'd just like to know what all the big questions
That's
are
right.
if we could get the other side. So, well, we had called on Hershey and Jim.
how the funding was going to be taken care of, coming from both, the health benefit exchange. That's obviously a concern because we've done, as you said, we've dipped into it now 3 times, or two legislation, but still make sure the reinvestment is working the way that we originally set up. So I do hope that can be addressed and you can get the information you need to make sure we know how this is funded. Maybe for the sponsor, just in following on what Malcolm was just talking about, when we set up the community, there's, I guess, 4 different things that talk about how it's done. I'm a little confused because, one, it says it's small enough to allow the incentives offered, and then number 4 says has a minimum population of 5,000. Page 5. So I'm just wondering how these communities are determined.
Right. And so this language here is based on how we set up the original health enterprise zones. And because, there are some rural areas that are in our state that have some serious
Right.
health disparities. And so we want, and the original health enterprise zones really benefited those communities that are in rural areas that had these health disparities. And so we wanted to make sure that they had an equal opportunity to participate in some of these disparities.
Well, you're going right down where I was headed with this. So why does it have to have a minimum population category? I mean, again,
So,
if we look
yeah.
in some of these small rural areas that have a lot of these same issues, I mean, I don't know if we can get to 5,000. I'm not sure how this is geographic. It just says that it's based on geography, but I'm not sure. I mean, that doesn't mean jurisdiction or municipality
Right,
or anything
exactly.
like that. You draw the line wherever you want.
Right.
But why the minimum of 5,000 residents?
And so part of it is looking at an area and a population large enough to see some impact. You remember, the goal of this is to really, address some of the hospital readmissions and other things that are costly on our healthcare system. And so we said geography for a reason. That's why we didn't say towns or
Right.
counties or legislative districts, because we wanted to have a wide enough area to actually be able to see the data and what changes is making on that system. I forget what county was highlighted in the original HEZs, but because it was, pretty much in a rural area, I believe it was in Southern Maryland or some
Probably.
Caroline, Dorchester County part of what the HEZs was able to do was give greater access to healthcare by having, mobile, health available to those communities. And a lot of times, especially in rural communities, there's such a distance between homes or distance between the healthcare providers. That was something that they desperately needed. And so this is really modeled to make sure that we still accommodate for those communities.
Okay, two minor things. I just hope that the number 2 and number 4 don't contradict each other enough, that we're trying to find somewhere small enough, but maybe with the minimum population of 5,000 residents, we've taken some areas that could benefit from this. The other thing, in number 2 of this, we talk about health disparities, including racial, ethnic, geographic, and disability-related disparities. But over in the list that you mentioned before,
Also,
on page,
socioeconomics.
yeah. Why don't we have socioeconomic there?
It is.
Where am I? Why don't I see that?
Are you on page 4? Lines 24 through 29?
No. Well, page 4, we list a number of the reasons why this happens, right? But then when we determine the community, we don't list socioeconomics.
Which page are you on? It'll be helpful for me to follow you.
I'm sorry, I'm on page 4, where you
Okay.
read the list of,
That does sound very important. I would just
Right.
suggest that we ask the analysts to really search the whole document. And anytime we are describing the same variable, that we include all of the same variables each time we
that's all
describe
I'm
the
asking,
people
yeah.
for whom-
Yeah, if you could just
I get-
help me understand where you are and what your
I'm
question
I'm sorry,
is. That's what I'm-
I read the list from page 4, and
Uh-huh.
then on page 5, where we list how a community is identified, in number 2, we don't list socioeconomic status.
Small
We
enough to allow for
we do racial, ethnic, geographic,
So we're going to ask him to keep that consistent,
Yeah.
the more comprehensive list.
if that's possible.
Oh, I see what you're
I can
saying
address
right
that
there.
if you'd
Okay.
like.
Okay, yeah. However you-
So what I would point to is that from what Senator Hayes was suggesting we look at, which is the definition of health disparity on page 4, which includes socioeconomic status.
Right.
And then returning to page 5, we see that we're talking about the definition for a health equity resource community. And under 1, it specifically says demonstrates measurable and documented health disparities, which would refer us back to the definition of health disparities on page 4.
Okay, I just, again, I've got a little problem with, I think 1 and 2 contradict each other a little bit. I just want to make sure that I like this bill a lot as well,
In other
too.
words,
Much better that we don't have
Even
it.
if it was slightly redundant,
I just
be sure we get
want to
the
make sure it
votes
can be
we
used
need
for
to
a
pass
lot of
the
different
bill.
groups. Thank you.
First of all, I'm really pleased that
We don't have a lot of time now, come on.
I'm very pleased that we're targeting the health enterprise zones. That is wonderful, because as you recall, under Congressman Brown, $4 million was allocated to the health enterprise zones. Now, the question I'm asking you is 2 years enough to accomplish what this piece of legislation?
No, ma'am. 2 years is definitely not enough. One of the things that we originally proposed with the alcohol tax, we wanted to make sure that this was permanent. Obviously, we've taken the alcohol tax as a funding source out of it, but this is an anticipation that there will be permanent funding to help funding. So 2 years would definitely not be enough. And so this bill hopes to address an ongoing funding source that would be available to these communities.
Because what the bill is saying is that it talks about the 2 years,
Right. So
and then
yep. I'm sorry.
what happens after the 2 years? They're asking that these centers be self-sustaining.
Yes, ma'am.
So you're saying that this needs to be accomplished in a 2-year block?
No, ma'am. And so, one, we want to build off the success of the original HEZs. So this is the supplement and complement those that were already in place. And I know your county benefited from one. I'm not sure of the geography there, but what we're asking for in 2 years is for an evaluation of how successful it is and a pathway on how to proceed in the future. So it's not saying that after 2 years, we're done with you, bye, go out on your own and be sustainable. It's really, giving us an opportunity to review it in 2 years, so we could see if there's anything that we need to tweak or change to make it even better.
I have to tell you, the reason why I'm asking is, when that money was allocated to the health enterprise zones,
Yes, ma'am.
those health enterprise zones were producing significant and wonderful results. I'm really sorry. I'm very sorry that program stopped. It's really unfortunate. Okay, thank you.
And one of the things that I'm also grateful with BNT is one of the things they acknowledge that hard work and using this as a vehicle to build on top of that and expand greater, to other places that hadn't had that. So one, reinvesting in the ones that had already started, but expanding opportunities as well.
That's right. That's right.
Okay, I don't want to lose anybody else, so the vice chair has to go do his harassment thing for 2 hours, and I don't want to lose anybody. I got to do it. Mine is later today, too. Okay. All right. All right, we've got a motion and a second. Yes, I'd like to be a sponsor, too. Okay, and Senator Klossmeyer and Senator Hershey.
Joanne, are you a sponsor already?
Are you a sponsor? Yes, she is. Okay, she's already. Okay. Okay. Are we ready to vote? All right. All in favor of the motion, please raise your hand. And the vice chair is already on it. He told me he wanted to.
That ends our voting session.
All right. Thank you, everybody. This is the only bill. Senator Bottle.
I just have a quick question. There are two bills that we were co-committee with that have come out of B&T. Is there any additional time to vote today? Because it was Senate Bill 788 and Senate Bill 902.
I don't have an idea right now, but
Okay.
if we can find the time, the analysts have the bills you're talking about ready?
Well, they've come out of B&T. I'll check with the analysts. Thank you, Madam Chair.
All right, thanks so much. This ends our voting session for now.